Thank you. The honourable member for Innisfail-Sylvan Lake, followed by Stony Plain.
Baby Annie had traces of prescription drugs in her system and pneumonia caused by fecal contamination. Her mother was a known addict and family violence was well documented. All 6 of her siblings were in government care. Yet 17 hours after she was born, baby Annie was sent home to her parents, and 14 days later, baby Annie was dead. What's shocking is that Child Services was involved with her parents for 8 years. Yet when baby Annie was born, nobody thought maybe it wasn't a good idea to send her home with these parents. To the Minister of Human Services, how do you explain yet another colossal systemic failure to protect 2-week-old baby Annie?
Honourable Minister of Human Services.
Thank you, Mr. Speaker. Mr. Speaker, as I've said before, the report has come out, and we'll ensure that the government responds to every single one of the advocates' recommendations. The fact is, every child that passes away that contacts our system is a child too many, Mr. Speaker. There's absolutely no question of that. This is a situation where, Mr. Speaker, we want to make sure that we are working very closely with other members of our government team to ensure that there's cross-ministry involvement with our children to better look after them, Mr. Speaker.
You bet. Supplemental.
Given that issues of family violence, drug and alcohol abuse were well known and documented by Child Services, and given that the Child, Youth and Family Enhancement Act prevented social workers from even conducting a safety plan prior to baby Annie's birth, which could have identified ways to save her. Minister, if legislation is preventing safety plans which protect children just like baby Annie, what is to say that another tragic death of a child won't happen again?
Honourable Minister.
Mr. Speaker, those are some very questions that I am asking right now myself. I think it's essential to see how we can work with families before there is a birth, Mr. Speaker, so that we can have the appropriate responses ready. There are, Mr. Speaker, I'm told, some constitutional challenges that arise in this area and have arisen in this area. The Supreme Court apparently has ruled in a few cases. But regardless of that, Mr. Speaker, the question is, how can we ensure that we are better providing services to people on the front end, Mr. Speaker, so that we can help protect as many children as possible?
Final supplemental.
I would be happy to work with the Minister on how we remove that barrier. Given that one of the recommendations coming out of the review of baby Annie's death is that Alberta Health Services and Children Intervention Services should work together and develop a shared mandate for the well-being and safety of vulnerable children. And given that this is the exact same recommendation that was made 3 years ago in the death of another young child, how many more children have to fall through the cracks and possibly die before the recommendations of 3 years ago are finally implemented?
Honourable Minister of Human Services.
Mr. Speaker, you'll find in the report that public health, Mr. Speaker, as well as Human Services, did actually follow up with this particular family after the birth. They did have visits with the family as well, Mr. Speaker. Regardless, it's a traumatic and very difficult situation that the child has passed away, Mr. Speaker. There's no question of that. And we're going to look for every way possible to see how we can work together to ensure children are looked after, Mr. Speaker.